Let me ask if this has ever happened to you. You're sitting in the dental chair and you know you've got good home care. You brush twice a day, you floss, you take great care of your teeth, you rinse, you don't eat bad food, you don't eat sugary food, you don't sip on Diet Coke. Yet you come in to see us and wouldn't you know it, we found 2 cavities. And you're sitting there, why is this happening to me? My 18-year-old son never brushes his teeth and doesn't have a cavity. Or my husband brushes his teeth once a day and never has cavities.
Down in Brookhaven, with a smile shining bright, Dr. Langston's working late into the night. With hands steady and a gaze so keen, he's the best on pots the dumbest you've ever seen.
Hi, I'm Dr. Brett Langston. I'm a prosthodontist and the owner at Dental Implant and Aesthetic Specialists in Brookhaven, Georgia. When I talk to patients about what causes cavities and why some people get more cavities and other people don't get cavities, it really breaks down to the kind of bacteria you have in your mouth. The first type of bacteria are the kind that attack the bone and the gum tissue, and those are periodontal disease. And basically what happens is no matter how good a job you brush, how good a job you floss, those bacteria attack the bone and the tissue levels. And so what you'll see is over time, that bone and tissue starts to shrink away and the teeth get more and more mobile, and then all of a sudden you lose the teeth. Now, sometimes it can be really aggressive periodontal disease and you can lose all your teeth in your 20s and 30s. Sometimes it's a more slowly progressing disease and you don't start to lose teeth till you're middle-aged or your later age. Sometimes it can be localized in just one area, but the root cause of that tooth loss is this periodontal bacteria. The second type have Kerodonic bacteria, which basically means they have the bacteria that attack the tooth structure. A new cavity every time we see them. They do a good job of brushing and flossing, but inevitably have lots of fillings, lots of crown work. Sometimes they lose teeth because that decay has reached the point where we can't save the tooth. The third type of patient I call the unlucky ones because they have both the bacteria that cause cavities and the one that attacks bone. And these patients, I don't want to say they're doomed to be without teeth, but it is a large uphill battle because the mouth, if it's harboring those bacteria, it's hard to protect the teeth and the bones at the same time. And the third category I call the lucky ones because those are people that have bacteria that are super friendly to both the teeth and the bone, and it seems like no matter what they do, they're never going to lose their teeth or get cavities. That category of people can get away with not brushing their teeth as well. Now, it's not going to do anything for bad breath or anything for plaque or tissue inflammation, but in general speaking, they've been the lucky ones that are blessed with the right bacteria that don't attack their bone and tissue. One of the neatest things that we have kind of on the horizon in dentistry is we're starting to learn about periodontal pathogens. And what I mean by that is we can actually do a saliva test now where we can break down the bacteria that you have in your mouth that are really helping us to understand kind of the bad 4 or 5 bacteria that when they're present in your mouth are going to cause lots of damage and breakdown. And so now we're able to kind of craft a whole approach to eliminate those bacteria from your mouth and give your mouth the chance to kind of heal itself and start fresh. So it's a really exciting future with the ability to treat teeth in the mouth at a bacterial level, something we haven't really been able to do in the past. If you find yourself asking, why are my teeth like this? The answer may not be your fault, it may be those bacteria. So come see us, we can do a saliva test, and we can help you figure out why it's happening. I'm Dr. Brett Langston, I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on pots the dumbest you've ever seen.